Hello friends, I am Dr. Manish Mittal, a senior consultant and in charge, Department of Neonatology at Cocoon Hospital, Jaipur. Neonatal jaundice is a very common issue that we commonly see in newborns. 85% of term newborns and almost 100% of preterm newborns do develop jaundice within first week of life. It's not mandatory that all babies who have jaundice will need treatment or investigations, but yes, all babies should be assessed and should be monitored for jaundice. This jaundice can be normal or it can be abnormal. So we'll discuss what is normal jaundice and what is abnormal jaundice. So jaundice in newborn means basically the yellow discoloration of eyes, the sclera, which is the white part around the eye, and the skin of the newborn. This jaundice basically is because of immaturity of the liver in the newborns. The old red blood cells in the newborns do break down and they release a yellow pigment which is called as bilirubin. The liver, being immature in the neonatal period, is not able to handle the load, and because of this the excess bilirubin is deposited in the skin and therefore the baby looks yellow. So this is the major pathogenesis of jaundice. This jaundice could be physiological, it could be pathological. Physiological jaundice means that there is little amount of jaundice which develops in a newborn at around day 3 or day 4 of life, and it is below a certain treatment threshold, and it settles on its own by day 5, day 6. When this bilirubin level increases beyond the treatment threshold, then it is called as pathological jaundice. The common reasons of pathological jaundice includes a blood group mismatch between the between the mother and the baby, which is called as hemolysis. It can also be because of certain infections, certain liver disorders, or it could be a genetic disease because of which the liver is not able to handle the excess bilirubin load. So as I told you, neonatal jaundice means it is the yellow discoloration of the eyes, the sclera and the skin of the newborn. So the degree of jaundice depends upon how deep the jaundice is. It depends upon the degree of bilirubin discoloration and the age of the baby. So we accept little amount of yellow discoloration beyond till a certain age, but if the bilirubin levels increases beyond that or the yellow discoloration exceeds beyond that, so then we need to investigate and we need to treat that. So neonatal jaundice is diagnosed basically by a physical examination where a trained nurse or your pediatrician can watch or can look for the signs of yellow discoloration. Minded that this yellow discoloration should always be looked in a natural sunlight and not in an artificial light, because if you try to look for the yellowness in the artificial light due to a yellow background, the baby's eyes and the skin may always look yellow. So it is advised that you take the baby outside in a natural sunlight and you try to blanch the skin of the baby and look whether the underlying skin is yellow or not. Many a times this physical examination may not be accurate enough and you might have to subject your baby for a blood test. So if you measure the serum bilirubin levels through a blood test, it will give you the accurate measurement of the jaundice levels. There is also some non-invasive techniques where you can have a transcutaneous bilirubinometer, which is a non-invasive device which is placed on the baby's forehead, and it gives you a rough estimate of the bilirubin value. But this is only a screening tool and it is not a confirmatory tool. Now as far as treatment is concerned, the main treatment of jaundice is what we call as phototherapy, where we keep the baby naked under a special blue lights. It's a combination of blue and white lights where the baby is kept under that, and this phototherapy light helps to clear the bilirubin pigment. It oxidizes and the bilirubin pigment into certain chemicals that are excreted into the urine and the stools. Apart from phototherapy, we also need to focus on feeding, because better the feed of the baby, the better is the enterohepatic circulation and the bilirubin pigment is excreted out of the stools. Now if you feel that the jaundice levels are too high and the phototherapy is not effective, then we might subject the baby for an exchange transfusion, where it's an invasive procedure where a central line is placed and the blood of the baby is replaced with a fresh blood so that the jaundice or the bilirubin pigment comes down rapidly. So these are the basically two modalities, the phototherapy and exchange transfusion, apart from the other supportive measures like good volume of feeding. Now that's a very interesting question, because many a times when the mother comes to us and whose baby develops jaundice, so the first and foremost question that she asks us, doctor, is it related to my eating habits? So there's an orthodox myth that if the mother eats yellow colored food items or wears a yellow colored dress, then their baby is likely to get jaundice. So I would strongly discourage this fact. This jaundice, as I already told you, is related to immaturity of the liver and is not related to the maternal diet or maternal clothings. Some people also subject their babies to variety of pujas and jhad fuks, thinking that this puja and all can help the bilirubin pigment to come down. But then again, as we already discussed, the treatment of jaundice is a medical treatment and is not something that can be treated by pujas and all these things. Some parents also inquire whether keeping the baby in sunlight can help to decrease the level of jaundice. Sunlight do have some effect on decreasing the bilirubin pigment, but it is not a sure method to decrease the bilirubin levels. So if your bilirubin levels are extending beyond the treatment range, it has to be medically treated.